We thank God that we have a privilege to share with fellow men all over in a time when we keep reflecting on the theme, godliness with contentment is a great gain. And one key principle of godliness is discipline. And since in our 8 core programs in the men ministry, man and spirituality, man and family, man and health, man and mentorship, man and environmental stewardship, man and economic empowerment, and also man and working towards overcoming addictions. We are glad that we can engage in a very profound discussion on men and health. And with us, we have one of us, a member of PCA Karen Parish. This is Dr. Chris Wagayo, and he has been in the area of health for the last 4 decades, that's 40 plus years, and it's an honor when we have such well versed with the area of health. And his greatest piece is on dental health. But I have the opportunity to welcome him to greet us, even say more about himself. Then later he will share with us. Welcome.
Thank you, Reverend Kyra. Hello, everybody. It's a great opportunity that I have been given and a privilege for me to talk about man and health, one of the pillars of Pcmf. As Reverend Kyra said, my name is Dr. Chris Wagayu. I practice at the Nairobi Hospital, Doctors Plaza. I'm a specialist in restorative dentistry. That is dentistry that deals mainly with repair, fillings, replacement of teeth with bridges, root canals. I've been in practice for the last 20-something years. Before that, I was teaching at the University of Nairobi before I retired early to go into practice because there is need to have specialist practitioners, even in private practice. I worship at PCA Karen. PCA Karen Church is part of Karen Parish, which has 3 congregations, Kuinda and Motero. And our minister, our moderator is Reverend Alphonse Kanga. And I'm happy to be here.
Thank you. Thank you, Dr. Chris. We are delighted. And we thank God that you got that time to leave your busy schedule so that you can build capacity and also lift awareness in the area of dental health. But before we get to dental health, let me give you an opportunity. Since one of the basic principles at the World Health Organization on health is prevention is better than cure. Kwa Kiswahili ni kuzuia ni heri kuliko kuponya. And since you understand this basically, I'll love you engage us for 2 minutes on why we need prevention more than curative health. Thank you.
Thank you, Reverend. Well, as the Bible says, the body is a temple of the Lord. And we have to look after the body because God created us with physical bodies that are good and a precious gift. And he created it in a way that he also gave us knowledge on how to look after that body. A lot of times when we wait for things to go wrong, like when you get a crack in a house, you don't repair, maybe that wall will fall off. If you get your car that is not serviced, eventually it might stop on the road for you. Unfortunately, we wait until our bodies stop or until they are damaged quite a bit before we seek help. And prevention, a lot of it doesn't cost much. because it is our lifestyle, what we are doing, and what we can do to improve our health. So when WHO says that prevention is better, it's because all those issues, especially of expenses, are reduced. The information can go to more people at the same time. And when you look at even budgeting, curative is always more expensive than when you prevent. So these days, a lot of the diseases we are looking at are lifestyle diseases. These are diabetes, heart disease, obesity, and all these, although they are very disabling and they are killing many people, they can be prevented. So we have to ensure that we have health in our bodies, starting with spiritual health, and then we can look at the physical health and social health.
Thank you, Daktari. And now, since we note prevention and one time engaging with somebody who worked with the older people at the World Health Organization in Nigeria, he came up with a conclusion that although we find men to be strong, they have the masculinity and also the ego, the conclusion was men remain the sicker sex.
Yes.
Would that be because they don't take much care of prevention? They go the last minute, so when they are towards the end, the energy is drained. Maybe you can comment on that before next now we have the dental health.
Yeah, one of the problems with men is, and maybe myself included, we tend to consult doctors less. We do not go until we have a problem. And a lot of diseases, by the time it tells you that there is a problem, it is already advanced. So men don't have good health, but they assume they have good health. And we hear of many people who are doing well, they are going to the gym, they are going to work, and suddenly they are no more. Because those diseases were not detected early enough. If something like diabetes or heart problem is detected early, it's treatable. Prostate cancer is a problem with men, and yet men wait until they have a major problem before they seek help. And yet, if that is seen early enough, treatment is effective, and somebody can live a good life after that. Cancers tend to spread, so the longer you leave it, the more likely it is to affect other organs. Diabetes also affects many organs. So if it is not seen early, by the time you start looking for help, maybe the kidneys are affected, maybe the heart is affected, the legs, you hear of numbness of the legs. Somebody is having their leg cut off because there's no circulation. But they have been seeing signs, but they have not actively gone to see a doctor. So although we talk about prevention, we also need to have regular checkups. And some of those medical checkups, especially for men who are over 40 years, should include the blood pressure, the heart health, if it's an ECG that can be done, blood sugar, cholesterol. PSA is a prostate antigen. So that tells you how well the prostate is functioning. If it is very high, it probably means something is not quite right. Okay? And then, of course, cancer markers, things that can tell you if there's something else that is wrong with the body. If somebody is having constipation all the time, or they start vomiting blood or passing stool with blood, it means there is a serious problem. And that should be attended to before things go wrong. And that is what happens with most men, because they sit on it, wanajikaza, kiume. And by the time they are being taken to hospital, many things have gone wrong. So it's important that we humble ourselves and get regular checkups.
Wow. So, in a nutshell, is saying, let's not wait until things go to the level of now when you are down And there is a way we say, when one is down, we will not refuse to be given a mark.
Yes.
And as I'm trying to translate how we put it, but kwa Kiswahili tunasema usipo zimba ufa tajenga ukuta. So ufa is that small crack, can be made early.
Yes.
But if you wait, finally you build a wall.
Yes.
Now we thank God, and we continue now to share more in depth on dental health. And this is your area of specialty.
Yes. We are going to talk about health of the teeth. We talk more about oral health because the teeth, oral health includes more than just the teeth. We look at the lower face, which is the jaws, the lips, the cheeks, the tongue, the gums, the tongue, and the salivary glands. So WHO has found it more fitting to talk about oral health than dental health, because dental refers more to teeth. The Bible tells us that in Corinthians 12 that there are many parts in the body, but they all form one unit. So if one part of that unit is not functioning, the whole body is not functioning properly. And that is why oral health is important, because it is part of the body. Other diseases may also show up in the mouth. The mouth is like a window into the body, and sometimes somebody has a disease and the dentist may be able to tell there is something wrong. Also, poor oral health can lead to other effects in the body. Why is oral health important? What is the use of teeth? And why do dentists repair, treat, and replace teeth? Teeth are important because they help us to cut up and chew food, mix with saliva, and facilitate swallowing and begin digestion. They help us in talking and making different sounds. Somebody who has no teeth will have issues with some of the letters. They give the face its shape, and we have a nice smile when we are talking. And sometimes they're also useful in terms of age determination. And if somebody is being identified, one can use the position of the teeth. Some of the diseases that are in the mouth can affect the rest of the body, as we mentioned. So the bacteria from the mouth can cause heart disease, infection of the lining of the heart, what we call endocarditis. Also, if somebody has diabetes, we find that it becomes more difficult to control sugar if there is gum disease. We also notice that in some studies, people with gum disease tend to be more likely to have strokes. The bacteria in the mouth can also collect in the lungs and cause pneumonia and other problems. And there is also a link between, especially women, although we are talking about men's health, but it's found that women who have gum disease may have premature births with small babies. So basically we have three sets of teeth, different teeth. We have incisors, the front teeth, which just bite; canines, which are one of the strongest teeth in the mouth for tearing; premolars and molars do most of the chewing. Children have 20 milk teeth, which fall out. They erupt from about 6 years to about 12, 14 years. They fall out, and they are replaced by permanent teeth. Now, the common dental diseases, the ones that affect the health of the teeth. Periodontitis is gum disease. Cavities is dental caries. Then we get gum recession, where the gum tends to peel away from the teeth. If dentin is exposed, it can be sensitive. Where somebody falls or hit by something, the teeth can be damaged, dental trauma. The teeth may not fit into the mouth very well, what we call crooked teeth, so there is malocclusion. And sometimes the joint that helps us with the movement of the jaws can cause pain, what we call pain dysfunction syndrome. And then, of course, we have any other infections, lesions, cancer that happen in the rest of the body can also occur in the mouth. That's just a general x-ray to show that the position of the teeth is a panoramic x-ray, and we can see at the ends the wisdom teeth may not fit in properly, and it can also show us other issues on the jaws that are going on. So, gum disease. The symptoms, that is what the patient complains of, include having bad breath, red or swollen gums, gums that are a bit painful and they may tend to bleed. They may get pain on chewing, and then eventually the teeth become loose, you get sensitivity. The gums start peeling off from the teeth and people appear to have longer teeth. There's also quite a common occurrence of food going in between the teeth. So you find that most people with gum disease, as soon as they finish eating, they'll look for toothpicks. So gum disease starts initially by just irritation of the gum. The gum is a bit swollen, maybe a bit, bleeds a bit, because of the collection of the bacteria in the mouth. The whole body has bacteria on the surface, and bacteria in the mouth will now cause irritation of the gum. This is a reversible problem, gingivitis. If one is deficient in brushing, the irritated gum will heal. Periodontal disease involves more than just irritation of the gum. We start getting now the separation of the gum from the tooth. The gum starts shrinking from the teeth, and we have sometimes mobility of the tooth. We may have swellings, and we may have a lot of pain. This is just initial signs where the gum is just irritated, a bit swollen, advanced a bit more, with a lot of tartar deposits on the teeth. The gum is very swollen, and in this case you find that if somebody is brushing their teeth or even biting into something, they'll probably find that there is some blood coming out, or somebody wakes up in the morning and there is blood on the pillow because the gum is that irritated. And the tartar deposits, when we brush our teeth, we are able to remove the soft deposits, what we call plaque. Tartar deposits are hard. You cannot remove them with a toothbrush, and usually a dentist has to do removal by cleaning or what we call scaling. As the gum disease advances, we tend to get abscesses, swellings on the teeth. The teeth start looking longer. So you'll find somebody who has teeth that are long, or they have moved out of position, they have many spaces between their teeth. And the front teeth, especially the top teeth, become very prominent that they are almost sticking out. In this situation, the teeth can even fall out on their own without necessarily having to anything active, just biting into something. So with gum disease, how do we protect? As I said, the initial irritation of the gum is irreversible. By effectively brushing our teeth every day, we should be able to reverse that problem, because we are just reducing the bacteria in the mouth. You cannot remove bacteria completely. You can only reduce the food debris and the products of the bacteria by using a toothbrush, a medium brush, fluoride toothpaste. Flossing is important because when we brush our teeth, we do not clean between. A toothbrush does not go between the teeth, and it is necessary to clean those areas between the teeth. We should eat a healthy diet and avoid any added sugars. And if the toothbrush is wearing out or becoming sprayed or worn, we should replace it frequently, maybe every 2 or 3 months. And obviously, having regular dental checkups helps, because the dentist can point out areas that one is not cleaning as effectively. Then we also avoid the use of tobacco, because it does tend to aggravate gum disease. Dental floss, there are other aids that help for cleaning in between interdental brushes, but toothpicks can also be used. But unfortunately, toothpicks tend to be very big, very thick. So if you are forcing them between the teeth, they do not clean as efficiently, and they may do damage to the teeth and to the gum. Risk factors of gum disease include smoking, hormonal changes. This we see a bit more with ladies, especially when an expectant mother, the hormones change. Diabetes is a major cause of gum disease, because if sugar is uncontrolled, the gum tends to get more infected. There are also other illnesses that may affect a person's ability to clean their teeth or to be aware of what they are doing. Some medications will tend to reduce the saliva in the mouth, like what is commonly used, pyritons, antihistamines, antidepressants, and may cause low saliva flow, which does not allow the clearing of bacteria as much or food debris. Abnormal overgrowth of the gum can happen with some medications that are used for high blood pressure, medications that are used for epilepsy can cause the gum to overgrow, and when it overgrows, it's more difficult to keep it clean. And of course, some people, due to genetics, are more susceptible and more prone to gum disease than others. Now we'll talk a bit about dental caries or cavities. Cavities are holes that appear in the teeth, and for the cavities to occur, we need four main factors. A tooth that is susceptible to decay, the bacteria that we have in the mouth, but bacteria that can cause decay. We need some form of sugar, not necessarily the sugar we put in the tea, but any type of sugar, and then time. The longer that the sugar stays in the mouth, the more likely that we are going to get decay. The tooth can be susceptible, or it can be protected by, especially where we have optimum levels of fluoride, the tooth becomes a bit stronger and it will not decay as easily. So when we have decay, in most cases it is silent. You may not get any discomfort at all. Sometimes we get sensitivity, or eventually part of the tooth will break, and that's the time that somebody will notice that they have a problem with their teeth. But normally a dentist will take x-rays, and x-rays will show even areas where cavities are not visible in the mouth. A patient may just be complaining of some sensitivity, they cannot see anything, but when we take x-rays, we can see if there are cavities, especially in between the teeth. And the white is fillings that are already on the teeth, but we can see where there is a cavity developing in that tooth. Management of cavities, we put in fillings in the teeth. A lot of fillings were being done with amalgam, which is a C/tin mercury alloy, but because of the mercury and damage to the environment, we are tending to move away from amalgam, and we are using more of white fillings, composite fillings, which look like the tooth, and obviously they protect the environment more. Where teeth have a lot of decay, and instead of removing the tooth, sometimes we do root canal treatment. And root canal treatment is not painful. The problem is that most times, because it's a large cavity, somebody hasn't slept for the whole night with pain. By the time they go to the dentist, they are already in severe pain. So cleaning out the tooth and putting medication will ease the pain, but it may not take it off completely. But the treatment itself with the local anesthetics we have these days is not painful. Teeth that are fractured, we can easily repair with the composite filling materials. And where a lot of damage has occurred to the tooth, crowns, caps can be done to replace what is missing. And where teeth have been removed, they can be replaced. Various forms of replacement. Bridges use caps on the adjacent teeth to replace the tooth. Dentures are removable, where you have either metal or metal and plastic, and they hold the teeth that are missing. These days, a lot more is being done with implants, where you are like trying to put a new root into the bone, and you put an implant and then build up a crown on it. So if we lose teeth, as we had said earlier, your appearance is altered, eating, chewing is not as effective, food goes between your teeth, there's probably loss of confidence, concerns about appearance, and then the cheeks, face starts sagging because we don't have enough support. And the joints can also be affected, that we are not able to chew properly and we get pain. So permanent teeth are important. They are there with you for the rest of your life, your entire life. Please take good care of them. And good oral health has been recently linked to longer life. If the oral hygiene is poor, life may be compromised. Yet, one of the problems that we have is that men don't have checkups. They don't take care of their teeth. Most of them will look for treatment when they are in pain, and they don't look for preventive care. They only look for treatment when there is a problem. It is important because you are with your teeth 24/7. A dentist only sees you every so often. So the cleaning that you do at home is most important. And we are looking at spending maybe 2 to 3 minutes. If you time yourself, the time you use to brush your teeth, maybe it's 20 to 30 seconds. Because as soon as you put toothpaste in your mouth feels fresh. Because that is how toothpaste is made. But if you were to brush your teeth without toothpaste until they feel clean, you'll find that it takes a lot longer. And that's the time that we should be taking to clean our teeth, to ensure that we clean all the 5 surfaces of the teeth: the outside, the inside, the top, and then the areas in between, which I said you clean by using dental floss. Sometimes we do get abscesses which may need to be treated with antibiotics. Tooth may need to be removed. Sometimes wisdom teeth don't fit in properly. So again, they may have to be removed. There are also areas where, especially now with children, the teeth may not fit in properly. And if they have crooked teeth, we have a lot of advances in braces and straightening of teeth. Even adults can have braces done. And teeth that are crooked are more difficult to maintain. So if they are straightened and they are aligned properly, then it helps us with the maintenance of good oral health. There are other issues that we may not discuss completely. The fact that you get cancers in the body, it means that also we get cancer in the oral cavity. You get cancer of the tongue, the mouth, the roof of the mouth, the tongue, the lips, and the gums. So all these areas are things that need to be checked regularly by a dentist. And then treatment can be done before it's very extensive, because some of them can be very disfiguring, like tumors of the jaws or the tongue. A lot of the jaw bone might need to be removed for the cancer to be removed. And that, of course, affects your appearance. If it is the tongue, if it's a small lesion, a small cancer, it can be cut out and removed. If it is very large, then you find that it becomes very difficult to treat it without removing a major part of the tongue. And then obviously that becomes a challenge even in eating, talking, and swallowing. So generally what we're saying is that we need to look after our teeth. They are important. We have them for the rest of our life. And most of the work of maintaining our oral health is up to us. You look after your teeth, but have regular checkups, because there might be some areas, some things that you may not see, and the dentist can help you with that. If you have cavities, fillings can be done. If there's gum disease, any of the hard deposits can be removed effectively by the dentist, and also you can be advised on how to effectively keep your teeth clean. Thank you, and God bless you.
Now, as we are coming to the end, I would love to have 2 questions to you. One is, we've been on a journey with men, and greatly when we talk of a man, we cannot isolate him from family. And maybe there is a word you'd like to pass to men in line with the health of the family. I would pose that question to you. Maybe I would ask the fears men always have. I can give my car a very good insurance, but I'm not mindful about the health insurance.
Yes.
How is all this? Are we godly when we are doing that?
I think we tend to ignore our body because it functions properly. We wake up every morning and the body is functioning. So we tend to give it less priority. But mechanical things, if it's a car, you can go and buy a new one. You can go and change the engine and put a new engine or tires.
Yes.
You cannot do the same with the body. Yet when it fails, it is more difficult to deal with. So for men, they need to be more active. We find that women have doctors, they have more regular checkups, they take the children for checkups, and the man needs to be engaged in that. Part of the social health is being able to interact not only with other men, but interact deeply with the family. Because they are the people who are going to tell you if something is going wrong. Yeah? You are not walking the same way you used to walk. We are finding that you are not quite the same. Maybe it's pointing to a medical problem. And when they are going for checkups, you should also make a point of being part of that team that goes for checkups. So men need to be engaged at the family level. They need to prioritize their health the same way they prioritize other things like cars and properties. That maintenance is more important for the body, because as I have said, you can replace all that, you can't replace the body. Yes.
Thank you. Thank you. Thank you, even underlining the need even for building our social health.
Yes.
And keeping on the regular checkups. Lastly, maybe I would give you a chance as a parting shot, and as we wrap up, as we continue with beyond this 1 week when men have been marking their week under the theme godliness with contentment. Maybe what would you pass as a man of wisdom, and God has blessed you with years and with experience?
Thank you, Reverend. We cannot be content if we are in poor health. So being content with properties and lifestyles without health, it means we are not satisfied. And we need to do the right things, live right, enjoy health, satisfied life. So you need to have time for yourself, because money cannot buy health. And even if we accumulate money, it will not give us contentment. Once the health starts failing, then whatever we have is of no use. God created us in his own image so that we can glorify him.
Yes.
And we cannot do that if we don't look after our health. And there has to be a balance because the real foundation of a contented life is having faith in God and looking after the body that he gave us. As we said, it is the temple of the Lord, of the Spirit. So if it is not being looked after, we are failing. And we have premises in the Bible. God tells us that in Psalms 121, he'll keep us from harm, he'll watch over our lives, and he'll watch our coming and going now and forevermore. So all he's tasking us to do is look after that body he has given us. And the onus is on us to look after our body.
Amen.
Thank you.
Thank you.
Amen.
To be content.
To be content, you need to be healthy.
You need to be healthy.
Yes.
And your health is also your wealth.
It's your wealth.
So godliness with contentment will go with care over your health, and then you enjoy contentment.
Because whatever wealth you have, whatever properties you have, if you don't have health, you are not content and you cannot enjoy it.
Sure. Thank you.
Thank you.